Cardiac rehabilitation is one of the prescriptions that we make when patients are discharged from the hospital with a serious cardiac problem. Many people think they can do it on their own. And yes, you know some things when you leave the hospital, but this really is a syllabus of things that people need to know in order to get back to normal activity. This really provides time totally dedicated to you to learn about your condition, to learn how to prevent future problems, and how to get back to a normal lifestyle.
After your cardiac event, life stops. And where do you go from there? Cardiac rehabilitation gives you this opportunity to make changes in your life.
We want to get you back active. You've been in bed for days. The thing that deconditions people more quickly than anything else is being in bed. So this is not something you delay for 1 month, 2 months. You want to start getting in the program within the week.
Cardiac rehab was a godsend. It gave me a safe environment, a place where I know I was being taken care of.
Everybody in here is trying to make themselves more healthy by doing a combination of weight training, strength exercises, aerobic exercise, and balance exercise. As we get older, these are things that are taken away from us unless we work at keeping them.
You have the staff, you have the safety equipment, they're right there watching you and monitoring you.
When I got sick, that's when I really put self-preservation into play. Taking better care of myself and not worrying about other things.
There's a remarkable cross-section of people. We've all made a decision for whatever reason, we're all gonna live, so they're positive.
It gives you that empowerment of knowing that you can take care of yourself. And not only that, you can improve your health.
Cardiac rehabilitation gives you tools that even a little mini change makes a huge difference. And that little change may actually impact your life in a very positive way.
Often patients don't realize how debilitated they become with a cardiac condition. Rehabilitation provides both education as well as supervised exercise performance to get you back to a normal physical state. And more importantly, for those people who are working, to get them back to work.
It comes down to statistics. We know that if people do what we ask, they have longer lives, higher quality of life, and they can do more.
They can exercise further. They may have more stamina, less shortness of breath, less depression, less anxiety. They may sleep better at night. They'll just have fewer disabling symptoms from their illness.
It's not just about your heart. It can help you with so many other things in your life. It can help with relationships, stress, meeting other people in similar situations.
A lot of people enjoy the camaraderie. That group dynamic, if you will, is an added benefit of cardiac rehabilitation.
Actually improving your quality of life, better sleep, reducing your anxiety or fear in life, but also feeling more energized.
If you're the patient's family member or friend, you might say, I don't know what to do, I just want them to be better, I just want them to live. What all of them learn in cardiac rehab is that there's always something that can be done. Forget the things that you can't control, but what can you control?
Patients will come to cardiac rehabilitation for a variety of internal motivators. Some want to just simply go back to return to work. Some may want to play with their grandchildren. Whatever level they want to progress to, we want to get them to that level.
Everybody deserves to have a high quality life. Everybody, no matter who you are and where you're coming from.
I have that spontaneity back. I'm able to be more autonomous, so not having someone to physically have to help me get out of the bed or dress or any of those things is great.
We tend to take life for granted sometimes. The sunrise, the sunset, the wind, the birds chirping. The world in general looks more bright and beautiful when you've come so close to dying.
Playing with your grandchildren or seeing your children graduate or whatever it may be that you feel passionate about, that you don't want to miss, you want to stick around for. You want to be there with your loved ones.
It's important to take care of your heart so you can live and be healthy.
Patients that go through cardiac rehab will tell you, just do it, get started. You're gonna see that it's probably different or better than what you thought it was going to be.
Just give it a try. There's nothing to lose. There's a whole life waiting for you, so just give it a try.